So yeah, so in this first one, we'll have a speaker, and the speaker will think about a change that someone else wants them to make. So to kind of spark your ideas about that, it could be feedback that you received from somebody. It could be a request that someone has made. It could be a recommendation that a professional has made, like a doctor or a dentist. Could be a family member's request that you complete a task or errand. Um, Something that someone else thinks you should do, but you don't really feel is that important. So then the listener will begin the exercise by asking what the change is and asking permission to talk about it. And then they'll try and evoke as much change talk as possible without hurting the relationship or evoking discord. So if we push too hard for change, we'll get more of that status quo talk, and you may even get discord, like you don't understand me. So some potential questions we've got written down there, you can take a look at. And then this was also in one of the emails. There was a link that you could link and grab this from. Let's see what that. Oh, that's nothing I need to deal with now. All right. So, any questions about the activity itself? No. All right. So then we just need a couple people to volunteer. One to be the speaker and one to be the listener. Hi, this is Jason. Before we get into this demonstration, I just wanted to briefly say a couple of introductory words about it. First, I am so thankful that Andrea allowed me to record this and to share it with you, because she gets into a couple of difficult, sticky situations here that I think are common to most of us who are trying to learn how to do motivational interviewing. And so to be able to see that, and for you guys to be able to put yourself in that position and think, what would I do in that situation? Or is this sounding like some of my conversations? I think is super valuable. Sometimes seeing someone struggle can actually teach you more than seeing this effortless, expert person do things perfectly. So I am very thankful that we got to be able to record this and share this with you. I hope that you'll watch the whole video and listen to the commentary at the end. A lot of the learning in these videos takes place at the end, where we all kind of debrief and talk about how the exercise went.
So I just want to start and ask
Yeah,
her what
go
her
ahead
problem
and
is. Is that what it is?
yeah, let's go ahead and ask her what the thing is that considering changing, and if you can talk about it, and then go from there.
Sure. Okay. Okay. Hi, Lisa. It's good to meet you. So you have something you'd like to discuss with me today. Is that all right if we do that right now?
Yes, it is.
Sure. Why don't you go ahead and share with me what you would like me to listen and hear from you?
Okay. Well, the thing that my husband keeps asking me to do is to talk more silently. When I get excited, I tend to elevate my voice. And it's really annoying to him, and he keeps saying, tone it down, tone it down. And it isn't that I don't want to, although it is challenging for me because I have a mental illness called bipolar, and I'm currently in the so-called high or mania stage. And during that time, one of the things is that I tend to talk more loudly. When I'm in depression, I don't. I talk my normal voice, but right now it's just very annoying to him.
Okay. Well, so what I hear you saying is that your husband is asking you to speak quieter to him at times, but you are saying that your state of bipolar at times is keeping you from that. Is that correct?
Well, yeah, I feel it is. I mean, I think it is a behavioral thing. And I think when he reminds me, I do try to tone it down. But in the moment, I'm not thinking about it. So my voice just elevates and I get excited and it just gets louder and louder. And I guess what he's asking me is he doesn't want to have to remind me. He just wants me to do it.
Okay, so um, what is it that you're hoping to resolve in the conversation? What is it that you would like me to help you with? Is it is it calming yourself down, or is it addressing the issue with your husband? Can you tell me more about that? Like, what is it that you would like help with?
Well, I guess one, I'm looking for affirmation that, yeah, it is a behavioral issue and it's not 100% under my control. I'd like it to be 100% under my control, just like I'm in a depression and I don't talk loud. But part of it I know is coming from that. And secondly, maybe if you can provide some resources for me, because my psychiatrist obviously can't. She just keeps trying to resolve it with medicine, and the medicine isn't doing anything to help with it. So if you have any other resources, maybe, some resources for counseling, maybe, I don't know, counselor that would deal with that kind of thing, maybe with behavioral issues.
So, are you saying that you are open to receiving some counseling help? Is that what you're saying?
Yeah. Mm-hmm.
And currently you aren't receiving any counseling. Am I hearing that correctly?
I was receiving some counseling from our pastor, and unfortunately that pastor took a call. He was very, not that he has, that much idea of what the illness is, but he was very helpful in the things that he suggested. And then I moved over to a different pastor, and he's helpful, but is not helpful as much with the bipolar per se.
Okay. So I hear you're open to some help, but you're looking for a referral and looking for some assistance in resources. Is that correct?
Yes, I am looking for a referral, but specifically for this as a behavioral issue. So it has to be somebody maybe that knows cognitive behavioral counseling, or I don't know if even maybe DBT counseling might be of help, and necessarily someone that's a Christian that is somewhat either a WELS member or someone in fellowship with WELS, that, I don't feel like I'm going out with someone that is way out in left base compared to what we believe, because I know that that can be a factor.
Okay, so I hear that you obviously have done some research perhaps in types of treatments. Is that correct?
Right.
And it sounds like your faith is a very important part of the treatment.
Mm-hmm. Right. Right. Because, like I said, I'm getting frustrated because my psychiatrist doctor is really only dealing with the medication. And I don't feel confident if I asked her for a referral that she would give me somebody that met all those qualifications that I just stated.
Mm-hmm. Stuck.
Want to phone a friend?
Yeah.
Okay. So I would say my general assessment is that you did a really good job focusing and figuring out what the issue is, right? And we've got somebody who sounds pretty motivated to seek counseling for behavioral aspects of therapy and has even done some research into that. So I think a good thing to do at this point would be to find out some of those darn cats about about seeking counseling then, since we've got it narrowed down and we know kind of what it is, and she seems pretty motivated, but let's use some open-ended questions to figure out why, why she desires it, why she feels able, why, needs, reasons, that kind of thing. And then once that's done and you feel like you have a fairly good handle on it, then, you could share a resource, and that's probably pretty good.
Okay.
I think it also highlights the importance of when any of us are talking with someone like that in a different setting. Let's say you were just connecting as a coach, you didn't have the expert hat on, and like being aware of those introductions or those boundaries of, I'm here to talk through what might be on your mind, help you move forward to a next decision, but I'm not at a place to give you specific medical advice or something like that. So sometimes, because it started to feel like it went down the path of like, oh no, I need to know how to help, in this really specific area. So, and that's hard because you're like, oh, I want to help you, but like, what's the next step? So having those initial understandings, or like we've talked about sometimes in class too, having a really, like Jason said, finding, okay, the reasons why you might seek it. And then maybe towards the end of your talking together, then you do have some lists of referrals, but digging more into the whys and the motivation can help. But it's hard when someone's ready. They just want the information right away. So sometimes it's that dance of, I remember sometimes when I was doing coaching and someone would be like, I just want to know, I need to eat this. And I was like, well, why do you want to do that? And they're like, it sounds like you're trying to coach me. I don't want to know why. I just want the information. So, and that's always that balance of where people are at too.
Okay. All right. So Lisa, it sounds like, I guess, can you tell me a little bit about what is your specific, what would you like to gain from therapy, or what is it that you're hoping to gain from that?
I guess I'm trying to gain some peace between myself and my husband. He understands to a point the illness, because I've had the illness for almost 30 years. And it's only been really since I went through some counseling, like I said, with the one pastor, that I had gained a better understanding of how the illness has an impact on the people around me, like my husband, my mother, other friends, that they get scared off. If they're a friend, they might get scared off because they think, wow, she's acting weird today compared to what I normally act as. So my motivation is to try and see if I can find some solution within my boundaries. I mean, that's kind of my challenge. My boundaries are that I want someone who's a Christian, and I want someone who knows the right, doesn't have to be those types of counseling, but just, I know that if I go there, I'm going to get some help. Because I've gone into counseling before when I was trying to lose weight, and the counselor was a previous counselor for mental health, and she was very nice, but her suggestions were like, well, you got to join up a weight loss, like, join this group or join that group, and they'll help you. And I'm like, I didn't ask you for that. That wasn't what I was asking for, is a referral. I could have went there with the Weight Watchers myself, and I wouldn't have had to pay you a fee to come here. And so it costs, I might get the insurance to pay if the counselor is in my insurance. If they're not, the total amount that I pay is going to be on me. And I'm going to make sure that as a consumer of counseling, that I'm getting what I'm paying for right out the bat. I don't need to go and explore everything about my mental health, because I think the other areas I'm working on, but this is one area that's a problem for me and I could use some help.
So what I hear you saying is that you desire to work very specifically on this one issue of the bipolar, of the speaking loudly, so to regain that relationship with your husband. Is that what your desire is?
Yes, it is.
So
That's-
it's really that. Have there been things in the past that you've had success? You know, have you tried anything in the past that you've had success with with working with your husband? Have you had some successes there?
Not really. Even early on in my illness, my counselor would try to get my husband to come to counseling to kind of understand better my illness. And he would come, and he'd come once, and then he'd be like, I don't think I need to come. So I think I was pretty much relying on the medication taking care of this. And just to take a quick step back, up until a year ago, I was on a medication, lithium, that was I never had this as an issue. Never. I never spoke loudly. I had other things that were part of the mania, but this was not one of them. So this is new to me in the last year, having to go off of lithium due to problems with my kidneys and going on a different medication. And all of a sudden these things came about and I have no way to deal with them. And apparently my psychiatrist doesn't either know how to deal with them because she's not.
So it sounds like some of this is some new things that have to do with the medication change. So you're looking for some
Clear, but
yeah. So you're looking for maybe some ways to manage that from that. Okay. Is there it sounds like I'm hearing from you that that you're ready to do this, that you do have that you are willing, and I hear that from you and what you're saying. Have you taken any steps? Have you to see a counselor outside of your pastor?
well, I did go out to our insurance website, Aetna, to try to see who the counselors were. And then I got really busy with other things and I kind of just put the list aside and I didn't go any further with it.
Okay. So you started the process. Okay. Is there something that more information that you were looking for in that process of looking for a counselor? Is there something in that you were?
I guess maybe if you might have access to, let's say I would provide you with a few names of counselors that say they're Christian. If there's any way you could help me find out what their background is, like are they Baptist, are they Pentecostal, are they, Catholic, or what is their Christian background? And I don't know that I suppose I could call the clinic and ask, but I don't know if that would be something that they would share with you before you come in.
Sure. I'm hearing, sorry.
Yeah. You want to phone a friend?
Yeah.
Okay. So I would say, so the specific request is probably outside your scope,
Yep.
right? So
yep.
you wouldn't be able to do that. I think what Lisa suggested about calling, you can probably call and say, this is my preference. Do you have a counselor who has X, right? And then there may be resources within the WELS that she could connect with a counselor. I know of a website that has just WELS counselors on it, right?
Mhm.
That we could share as well. So I think, yeah, we can probably stop there. I think in terms of feedback, I think you did a really good job of narrowing the focus down, which is something that gets missed a lot. And you had high agreement about what the conversation was about. In terms of like an area to improve, I would look at open-ended questions.
Mhm.
So a lot of your questions were could be answered one way or another. Or they started with, is it this, or would you like that? And so you can ask those same questions that are open. So that would be an area to work on. Amanda, any thoughts?
Yeah, I agree that those are good feedback. And I think too, we very easily want to, when we ask a question or what we have talked about too, like just stating what you're reflecting. So not necessarily feeling like you have to ask it in question form, but just saying, so you are just saying you want to see a counselor, and
Mhm.
just, statement versus question. And sometimes that inspires further versus just saying, because I think sometimes you said correct and then she would just say yes. So
Yeah.
it kind of closed the conversation. Then you had to come up with another question. And so then I think you felt like you were just continuing to try to figure out what was next. And it was hard to get the flow.
Yeah, it puts a lot of work on you,
Yeah.
because you have to keep, yeah, you're doing a lot of the work.
Plus, I just
Lisa,
wanted to answer the question.
Yeah.
Lisa, from your perspective, anything that you think went well, or any areas for improvement?
But I agree with you. I think she narrowed it down fairly quickly as far as exactly where. And then, my recollection of saying, okay, well, part of it stemmed from a medication change, which kind of took it off, focusing on maybe going down that route versus saying, maybe it's more of a counseling issue because of the last year and change in the medication.
Mhm.
Now we're with the doctor. So I felt good talking to her. I felt like she was trying to be very helpful and finding the right, grasping at straws, because she doesn't know either, but,
Yeah.
kind of where I was at starting out. I really don't know, because I know in the past I've heard from some of the pastors that you have to be careful who you see as a counselor, because sometimes if they're not totally committed to Christianity, they might take you down a different road and
Mhm.
might try to make you convinced that Christianity is the cause of the problem.
Yeah, so you're
And I,
concerned that if there's like a difference in values, that
right.
that wouldn't be helpful.
Mm-hmm. Right.
Okay.
And, it might not become an issue for this particular behavioral issue, but once you establish a relationship with a counselor, you might need that counselor down the road, and it might be for a different issue. And then that may be an issue where you really need a supportive Christian. So,
Yeah, that makes sense. So I know a website that has WELS counselors on it, and it also has some pamphlets about Christian versus secular counselors and stuff. So I can send
okay.
you that stuff in an email after
Yeah.
this too. Yeah.